guys, my name is Kate Trader. Welcome to my channel. Now, 2020 has been a very eventful year. Eventful on the sadder side, from war to bushfire to so much sadness to even coronavirus taking over the whole world and even putting everyone at home. The stories have been immense, but today we're going to be taking a look at a story of someone who has gone above COVID-19. Yes, he's known as a DJ right here in the country. He calls himself Seth Giovanni on Instagram and Twitter and everyone. I know him personally as a friend and also a DJ who have been able to enjoy some of his mixes, but he's dived into tours and travels. But also, knowing him personally, I have known a couple of issues that he has gone with, a couple of issues he has been able to tackle with his health. Now, contracting COVID-19 is not something easy. Seth, I want to know what happened that very day when you went for the test for COVID-19.
Actually, the very first initial test that turned out positive, I had been admitted in hospital. I had been admitted for 3 days. I was put in the isolation ward at K&H. But the test was done on the third day. So all along, I didn't know what exactly was going on.
Okay.
At the back of my mind, I thought it's pneumonia because that's what I felt. I had had it before, so the signs was one and the same. And then when the test was done, the test results came back on the Saturday, the very first Saturday of July, at around 11 in the evening. So immediately at that point, when the nurses came and woke me up, they didn't exactly tell me what was going on. They just told me they were going to transfer me to Mbagathi, and there was a lot of confusion. But somewhere down the line, that's when I was told that I'm COVID positive. Right?
Sorry about that.
Yeah, and I wouldn't even be able to tell what my first reaction was to the news, because it was a shocker, yes. And it was, I couldn't believe that of all things, it was COVID that I had contracted.
Yeah.
Because the very moment they told me that, it made me think of all the things that I've given up, trying to avoid this very exact situation. Giving up my career, giving up the chance to be able to provide for my family fully, giving up a lot of opportunities and business opportunities mainly that I had already tried to rack up. So all that just went down the drain. That's exactly what was going through my mind.
Yeah.
All the effort that I had put in to try and avoid it just went down the drain.
I can imagine. And let me tell you why the story of Seth Giovanni, aka Aaron, but people at home call him Aaron, I call him Seth, some people call him Giovanni. Let me tell you why Seth's story is very unique. So many other times have we had that anyone who has an underlying issue is going to pass away. And it's been said, anytime the Ministry of Health comes there, they're like, we need to take care of the vulnerable people, someone who has diabetes, pressure, who is a cancer patient or a HIV patient, are always told to stay away because it would easily turn into a death case. So why is that story very unique? He has 3 of the underlying issues. How did you survive having 3 underlying issues? Please tell our viewers, because I know some of them want to know why is that story so unique amongst others.
Yeah, actually, to correct you, it's actually 4 underlying issues.
Yes.
That's diabetes, hypertension, rheumatic heart disease, and pulmonary embolism.
Oh,
Now, pulmonary embolism is not that common. So for those who don't know what it is, it's actually having blood clots in your lungs throughout. Yeah.
Whoa.
And you see, all these things started for 2007. So for the last 13 years, I've been having underlying issues. It's put me in situations where none of my family members or my friends thought I was actually going to make it.
Yeah.
But somehow I end up making it. And so it's been a huge experience for me. But when it came to COVID, that's where everything was different. Because we hear all the time from the Ministry of Health, doctors, the WHO telling us that, if you have these underlying conditions, you need to stay away from the public. And out of the 6 that they mentioned, I have 4 of them. So for me, the public was a no-go zone. And I really tried to avoid it. But I can't exactly say how I ended up beating it. Because it got to a point even I didn't think I was going to make it. The doctors didn't think I was going to make it. My family didn't think I was going to make it. I myself didn't think I was going to make it. But I think at the end of the day, I usually say at this point, it's the grace of God that I did.
It has to be the grace of God.
Yeah, it has to be the grace of God because there was nothing else left.
It has to be the grace of God because when you tell me, especially the rheumatic fever, I know someone in my family who's had it.
Yeah.
But
pulmonary embolism.
Pulmonary embolism.
Yeah.
That for me, that's a shocker. Because if you already have blood clots on your lungs, and we know some of the things that take the lives of so many people who have tested positive for COVID-19 is blood clots.
Yeah.
But one of the most unique things you have to understand, treatment in Kenya is a little bit different. Juzi ilisemekana ya kwamba 43 billion was lost. 43 billion meant for treatment, to pay, and so much. Tell me about your experience when undergoing treatment for COVID-19.
Treatment for COVID-19, it's actually quite peculiar because there's no actual treatment for COVID-19. The only treatment that is there is for the symptoms that you present. Right? You have headaches, they're going to treat you for the headaches. You have fevers, they're going to treat you for the fevers. You have chest pains, that's what they're going to do. They're going to treat the chest pains. So there's no actual treatment for COVID-19. For me, I'd call it like, taking a chance with whatever comes their way.
Yeah.
Because for me, I had different symptoms. I had chest pains, I had, coughing up of blood, I had the high fevers and all that. So 1 minute I'm okay, a fever comes up. So I'm calling the nurse, they come, they run, they check my temperature. Okay, so you have a fever, so that's what we're going to treat. In the middle of treating the fevers, then I start coughing up blood. So they're like, oh, okay, so there's this. Okay, so this is what we're going to treat next. You see, so for them, also for the doctors, when it comes to treatment for COVID-19, it's basically just treating the symptoms that you're presenting and hoping that they will be able to keep that in check enough for you to shed off the virus.
I get that. Yeah. But now when you're admitted to Mbagathi, you move from Kenyatta Hospital, you're admitted to Mbagathi Hospital. The experience, were there anything that you saw off when you're getting your treatment? Were the doctors on cue? Were the nurses able to reach out? There's some things we want to know for anyone who has been inside the hospital itself.
Yeah. See now, there's a lot of things that happen that people actually don't know. First of all, I was transferred from Kenyatta to Mbagathi at 11 in the evening, at night, in the middle of the night, and they didn't want to tell me what was happening or what was wrong. I asked them whether they informed my family. They said yes, but I'm calling them. They didn't have any idea.
Your family didn't know that you've been admitted?
They didn't know. We actually have phone call recordings of the conversations they had with the officials from Kenyatta. And it turned into a game of, that's not my department, you should ask someone else. Yeah. And that was alarming for everyone. So, okay, on my side, I get to Mbagathi at around almost midnight. They take my file. We were two people. They accepted the one who I had come with. He was actually walking. I was in a stretcher, yeah? So they accept that I get in. I'm taken out of the ambulance, and then the doctor takes my file, and all of a sudden is like, no, we can't take him. We don't have oxygen spaces. And I'm like, this is weird because one, yes, I'm having difficulty breathing, but I'm still breathing without an oxygen mask or anything. So what is actually happening? Why did Kenyatta have to move me?
An oxygen mask or a ventilator?
An oxygen mask, because they are portable oxygen that they have, yeah. Okay. So I don't need it. I'm actually breathing fine, just having a little bit of chest pain. So first of all, Kenyatta transfers me in the middle of the night, not telling me what was happening. I get to Mbagathi, they accept for me to actually be admitted there, and then all of a sudden they decline. So I heard the nurse who was with me at the ambulance trying to reason with the doctor, and the doctor was just so adamant they're not going to take me.
Yeah.
So they called KU. On calling KU, they checked the systems, I think they checked the systems because that's what the nurse told me, and also they declined me. So I'm outside in a stretcher, outside the ambulance in the cold, and I just decided, I was really, really weak. Like I was even trying to talk to my dad and my people at home, and they couldn't even hear me because I was extremely weak. So I asked this nurse, what exactly is going on? Just be honest with me. And he told me point blank that, okay, so the thing is you have COVID, and Kenyatta and Mbagathi have decided not to admit you because I don't think they want to take your case because they do not think you're going to make it. Your file already reads that you're not going to make it. And for them, it's becoming a matter of statistics. How many death cases have you people had? So none of them want that record of they had a patient die under their care. So could be that's the reason why they're not taking you. And I was actually shocked. I didn't even ask him any other question, first of all. I just lied back, and I was really trying to. You see that moment where you're going to die, so everything just starts flashing in your mind?
Yeah.
That is exactly what was going on in my mind. Because I'm like, okay, when I came to hospital 3 days ago, I actually left the house thinking I'm just going to get an injection or treatment and then head back home. I did not say goodbye to my kids. I actually didn't. I there's so many things that I wanted to do, I didn't get to do them. And now it seems like I'm not going to get the opportunity to do it.
Yeah.
And the people that I'm expecting to help me out are the people who are actually shutting me out. Yeah. They're the people who are like, we don't want your case because you're not going to make it. And by the way, for us, it's all about numbers. It's not about saving lives or trying to save lives. And so I asked him, why would it be like that? And he told me, with the way the health sector is facing right now, the doctors are more concerned with people that they can save. Save as many people as you can. For people that they don't think they can be able to save, they don't see the point of using that bed space, using that oxygen on that person when they know they're not going to save that person.
They don't want to waste time to save a life that they're not sure about.
They're not sure that,
Okay, so down the line, 2 months down the line, you're much better.
Yeah.
If we look at treatment, the treatment that you were able to get, what were some of the things that you feel like worked for you? Noticing that you have 4 underlying issues.
Yeah.
What are some of the treatments that worked for you, either in hospital or back at home?
One, in the hospital, because that's the point where, basically I had given up everything. I had given up on anything. Yeah. So initially, I don't think I'm going to make it out of the hospital to get to a point where I'll actually receive treatment from home.
Yeah.
So the biggest impact was the treatment that I got in hospital. Right. And that I would put it on, just the simple things that they did, dealing with the fevers and all that. Some of the nurses were actually pretty friendly.
Did you get some of the names or some of the doctors?
I wish I did.
You were just in your state.
The first 3-4 days I couldn't even move, so I was really in a bad shape. Yeah.
Okay.
I was in a really bad shape, but I can recall a couple of nurses and doctors who were really keen on my case. One of them being her name is Rose Mugendi from KNH. Another one is Dr. Wahome. I think he's from KNH too. I can't be exactly sure, but those were the 2 doctors who I remember being constantly on my case, to a point where they'd actually call me on the phone.
Personally?
Yes.
Okay.
They're like, how are you feeling now? Are you feeling any better? What's the problem? Okay, so what we're going to do is 1, 2, 3 things. They give you the reassurity of, we're on this, right? So as much as I'm feeling like I'm giving up, I was actually telling people, I could see people walk in or come in a wheelchair. People are much better than I am and not making it out. Right, so that is very discouraging, and I'm like, I'm badly off. I don't think I'm gonna make it. And the doctor,
if they're not making, who are you?
Who am I to make
it? That's doubt you can get.
Exactly.
Yeah.
For me, when I left hospital and I turned out negative after my test, I still had issues with my chest. To date, actually, to now, it gets to a point randomly during the day, I start having something that's called a pneumonic effect, where you tend to feel like there's water starts filling up in your lungs. You tend to feel like when you're breathing out, there's a bubbly sound that comes out of it. And because of that, you're choking, so you start coughing to a point so for me, because of the clots, I cough out that water and blood out of it, right? Yeah, it's gruesome, right? So yes, people do have side effects of that. For me, it's that and the eyes. My eyes have not recovered since then.
So what happened to your eyes?
The focus is just way off.
Okay.
Yeah, so I can't be able to see far because of the high sugars and the high pressure during that whole period with the COVID. But yes, COVID does have side effects. I call them side effects of, that they live in your system. Even if you're negative, your body is really, really damaged. That's the same thing that the doctors told me, that my chest has been really damaged because of the virus, and it's going to take a while for it to heal.
Yeah.
Yeah. So you meet other people who have had water retention, because I also had water retention to a point where your legs really swell up, your body retains too much water, and that's because of the pneumonia that most people had because of the COVID.
My goodness, clearly issues pertaining to COVID are very, very sad to hear, and his experience is one of many. Underlying issues clearly are not a death sentence, but as we're finishing up, Seth, you being a DJ is one of the fun things that you love to do. When you're mixing up right now, I want to know, just to make it light, what are some of the top 4 songs for you that have been, keeping you up this 2020?
The 4 top songs that have been keeping me up this 2020 is, I have a lot of love for where the Kenyan music is at the moment. You find the young people who are trying to do something different, and they would rather feature, turn into entertaining people. So for me, the 4 top songs that have been really, really moving me this year have to come from, this Gengeton guys, the Ethic, there's a Boondocks.
No, you have to pick out 4.
Okay, 4 of them. 1, Tessa. Tessa, I don't know how, but it's just too amazing. It incorporates a lot of local artists, which it's diverse. 2, we have this song from Ethic, Daktari. Bazoom. I'm saying, everyone is calling me, but then you made it only Bazoom say, so it just became something that I just love. The other one would be, I'm trying to rate on the 2 because they're just one and the same. I'd go for, let me just go with, because both of them are from Calligraph Jones. That is Tumakitu and How. Because How, it has a very deep message. How. It has a very deep message on cyberbullying, which I think everyone needs to really listen to and understand. And Tumakitu, because we're broke. Manzimi, I'm not even going to lie. We are broke. Me, if someone hits my M-Pesa right now,
uko sawa?
Nanunua credit kwanza nimpigie namwambia asante.
Oh man, Seth, please tell guys something, because I know a lot of people are scared and they don't know when you get COVID what actually happens. Just tell them, hi, my name is Seth Giovanni. If you have COVID, blah, 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 stay hopeful.
Alright, hey people, my name is Aaron Seth. Most people know me as Seth the Deejay. And what I have to say about COVID is you do not have to think of it as the end of the road, right? People have recovered, a lot of people have recovered, but do not there's a saying that says that prevention is better than cure. So don't go around thinking, ate kikuja, I'll do medicine and I'll take the meds and I'll be okay. It's better that you prevent it. And this thing is real. A lot of us Kenyans actually have this tendency of thinking that something is not real until someone they know has it. And that's one of the reasons why I went to Facebook, because I wanted people to know that this thing is actually real. I didn't think it was real. It got to a point I thought it's all hoax and everything, but it is real. It's here. And the only way that you can be able to beat it is by following what the medical sector is telling us. Because as Kagwe said, if you take this thing normally, it's going to treat you in a very abnormal way. Very,
So thank you so much. That's it for us. A hashtag is Kate Rera. Be sure to subscribe, like, and comment.
Hi guys. My name is Kate Rera. You want to watch my video? How about to click on like and subscribe on YouTube and watch what we do in studio and even outside.